I got a good one for you today. Man, this is a top 3 question that we get asked of us. All right. What is regenerative medicine? Well, regenerative medicine is a wide variety of things, but essentially the high and low details of it in a quick synopsis are tissue therapy. You've got damaged tissue in your body, wherever that may be, tendon, ligament, could be something with your cartilage and a disc in your spine or your knee or your ankle. Doesn't really matter. Could be neuropathy, could be a multitude of things, right? Muscle tissue damage, muscle tearing. What we're doing in regenerative medicine is we are using new tissue and the ingredients inside that tissue that have been provided by the Lord above to our bodies to be able to help regenerate and repair damaged tissue. All right? Regenerative medicine is not always just this magic pill, right? People say, oh, stem cell therapy, stem cell therapy. Stem cells are phenomenal. We use them here every single day, just about. All right? And they work phenomenal in the healing process for people. But there's a lot of things that go into it as well. What's the person's health status? What exactly is the severity of the tissue damage? Is it a full tear or a partial tear? Where is the tear? Are there multiple tears? Is the person a smoker? Do they treat their body with disrespect in terms of alcohol and drugs? Do they eat crappy food all the time? You think you're going to heal well from any injury if you're eating processed crappy food all the time? No. You ever wonder why patients who are on extensive wound care treatment for diabetic ulcers and things like that, why it takes so long? Because they're eating crappy food and they're not getting the raw materials that their body needs to actually repair and heal. We are regenerative, cellular, biological organisms. God created us to repair and to heal, okay? We don't have to tell our arm when we bang it on the door over there and cut our wrists that, hey, brain, I need you to repair every single day the cut that's on my arm. No. It just happens, right? So if you've got tissue damage in your body or inflammation, we know that inflammation is the root cause of disease, right? We know that lack of oxygen to a tissue causes inflammation. And if inflammation or tissue damage is not healing or repairing on its own, doesn't take a brain physicist to figure out something's missing in the equation. It's either a raw material, a mechanical issue, maybe it's a nutrient issue, maybe it's some sort of deficiency. That's why you got to do blood work. That's why you got to do extensive things to figure this stuff out. Does the person have a connective tissue disorder that's rare? You got to look at all this stuff. There's no 2 patients that are exactly alike all the time. People always just want to assume with regenerative medicine, oh, does it work? Does it work? Does it work? It works if it's done correctly most of the time, and it's used in situations where it's appropriate. If a certain situation warrants a surgical repair for a major full ACL tear, then that's what's warranted. We got to do surgery, right? But if there's many of other situations that are the proper ones to use regenerative medicine, then we can use it in those situations with a high efficiency rate, along with doing the proper diagnostics and many other therapies and getting the person metabolically healthy and out of a metabolic dysfunction and looking at all of these different things, including their nutrition, to say, let's get your body in a place to heal. Sometimes we add in peptide therapies, right? Branched chain amino acids that help tissue repair in the body, cell signaling. Hey, other cells come here and help repair this problem, right? That's what regenerative medicine consists of as a whole. That's the way it should be being done as a whole. If you're looking into regenerative medicine and you're going to some office in, I don't know, West Palm Beach or Miami or Orlando or wherever, it doesn't really matter, Timbuktu, Tijuana, and all they're doing is doing an IV of stem cells, quote unquote, and you don't even know what that consists of, how many, what type of tissue is it, where does the tissue come from, is it live tissue or dead tissue cells? If you're not asking these questions and you don't know these details, I would suggest maybe you ought to think twice about doing that, all right? You need all of this data and information before you go. You need to educate yourself on this before you go. And one infusion or one injection may not be all that's needed. Most likely it's not. Most likely there's other things that are needed along with it to get your body to heal whatever tissue is damaged. Knees, hips, spine, lumbar, cervical disc, shoulders, ankles, plantar fasciitis, tendon, ligament, wrist, carpal tunnel. It doesn't matter. Osteoarthritis, neuropathy. It doesn't matter. All of those tissue damaged areas of the body, whatever you may or may not have, whatever's specific to you is a specific case. We need to figure out what's the specific plan of care for you in your situation. What are all the things that need to be done to get that tissue healed and give it the best chance to be healed? What are the things that we can help facilitate that process? That's regenerative medicine. That's how you're supposed to do regenerative medicine correctly. If you're in an orthopedic office and they say, hey, yeah, just do PRP, it'll fix your stage 4 osteoarthritic knee. You think just taking some plasma and injecting it in your knee is going to fix your stage 4 osteoarthritic knee? No, there's probably other issues. Are you 30 pounds overweight and that is adding an extreme amount of pressure onto your knee that's disrupting your cartilage and degrading it? Well, then you probably need to lose weight too to get the pressure off your knee. The PRP is not just going to fix it by itself. You guys got to start, like I always say, you guys know I always say this, be your own advocate. Be your own doctor in a manner. Research, look things up, find people like us who are experts in our field and ask questions. We love when you ask questions. You know what's interesting to me? In terms of regenerative medicine, we have patients call here every single day. And one of the many questions that gets asked is, how do I know to go whether to go to one place or another? Well, I always tell people, hey, 5 things you need to ask. Where does the tissue that I'm getting come from? What's the name of the laboratory? Are they FDA cleared? Are they FDA registered? Is the tissue that I'm getting FDA cleared and registered? That's really important. And I don't know if you know the new Florida laws, but there's requirements on that, okay? For the provider, for what they're providing you, all right? Are the tissue cells dead or alive? Are there third-party testing to confirm post-thaw viability, right? After you thaw the cryogenically frozen tissue and it thaws out, what's the viability of that tissue after it's thawed? Don't you want to know this stuff? Yes, you want to know this stuff, right? How much of the tissue am I receiving? I want to know what vials of tissue I'm receiving. What are the lot numbers? What's the expiration date? That needs to be going into my chart, right? For my own benefit to know this is where it came from. This is the laboratory it came from. When was it harvested? Is it vaxxed or non-vaxxed tissue, right? These are important things to people. You got to ask these questions. And the reason why we do these videos and why I love doing these videos for you guys is I want to educate you on questions to ask, whether you come here or you go anywhere else. This video is going to go out to the masses. So odds are the majority of people who see this are not going to come here for regenerative medicine, just by sheer statistics, right? That's okay. If this just one person listens to this video and asks those questions that I just asked to a place that they're potentially going for regenerative medicine, and they figure out that that place doesn't want to tell them answers, or can't tell them answers, or won't tell them answers, or the answers aren't something that we've discussed in this video, then maybe you should consider twice even thinking about going there. And that was worth the video itself. If just one person heeds this opinion, that's all I have is an opinion, right? But I hope this opinion helps you guys. I know it's helped a lot of people in the past. We saved 2 or 3 people just last week alone from issues that they were going to have at other places just by pure dishonesty. That's what it was, pure dishonesty. Making one seem thing like it was something and then it ended up being another, right? So you want to go to a place for regenerative medicine that provides love, care, respect, honesty. That's what we strive to do here. And there's plenty of other places that do too. I'm not saying we're the only one in the world. There's plenty of other places that do too. But if you're looking for one of those places that has 5-star reviews and patient's family refers other family, and the majority of our new patients actually comes from our current patients referring new patients, that's the type of place you should consider going. We're one of those places. We're here in Fort Lauderdale, Florida. You can fly in, fly out. We have people fly in from all over the place on a weekly basis. We have people flying from Canada all the time because they can't get this stuff up there. So if you're Canadian, hey, think about it. Give us a call. We have a ton of Canadian patients. That's what you should look into. A place that's high quality, high efficiency, loves you, cares about you, root cause medicine, does all the proper diagnostics, and remember all of the other variable therapies that may need to go into your situation. If you want tissue placed in your knee because you have pain or discomfort or osteoarthritis in your knee and your cartilage is starting to degrade, and you say, hey, I want to do stem cell therapy in my knee, and you're 30 pounds overweight, the place you're going needs to help you lose 30 pounds so that it works for the long term. It gives it the best chance of success. Most places don't even say anything to you about that. They just want to collect the money, inject your knee one time, see you later. And that's that. That's why those places have poor reviews. You guys can look all this stuff up. All right? So do your research. Be your own advocate. Go to a place that loves you and cares about you, who uses the top quality tissue. By the way, all of our tissue is FDA cleared, FDA registered from Vidi Labs, and abides by the Florida and federal laws, right? So that's what you're getting here. We have no problem telling you that. We have no problem giving you all of the data testing. We have no problem sharing any of that stuff with you because we provide honesty here, right? When you're doing things the right way, you don't have to worry about doing things the wrong way, right? So if you guys want more help with regenerative medicine, if you have more questions about it, ask us. Hey, reach out, click on the button below, create a consultation appointment. Our staff will do it for you, take care of it for you. And we can get on the telephone with you. If you're from out of state, if you're from other country, whatever, we'll find a time to talk to you. We'll get on Zoom call, whatever we need to do, or you're welcome to come here. We'll spend 30 minutes to an hour discussing your situation. We will evaluate what's going on. One of our licensed providers will figure out a game plan that's best for you. And then we go over it as a medical team, not just one person, but our whole team's going over everyone's care plan because more than one brain is better than one brain, right? And looking over things. So that's what we do. We can help you with this. If you want to come see us, 754-222-6642, or just click the link below. Our staff can take care of it for you. You can be on the phone with one of our providers in probably the next 24 hours to 48 hours, depending on the day. We're usually pretty quick. So if you need help, give us a call. We love this. You guys know we love this stuff. We're passionate about it. We love regenerative medicine. I love regenerative medicine. And that's what we want is for you guys to love regenerative medicine. Regenerative medicine is phenomenal. It helps so many people. And yes, there are things that can be done to help people avoid surgeries or delay surgeries. There are situations that does happen. There's also situations where it doesn't because maybe the person needed to have surgery. But if you want a place that's honest and going to give you those types of opinions that we're trying to do the best thing for you and not for ourselves and give you the best information we can to help you make the best decision for yourself and you be your own advocate, we want to help you. Again, click the link below. You know you want to. You know you feel it. If you're looking into regenerative medicine, you need a place like this, Lighthouse Medical Center, the standard, the highest standard, setting the new standard. That's us. Click the link below. You guys have a great day. You know we love you. Keep asking these questions. We love answering them. And we'll talk to you soon.